Palpatory anatomy for the high school athlete, someone who has low back pain. One of the first areas I'll always look at is going to be the psoas. To find the psoas, which connects to all the vertebrae of the lumbar spine, also connects to the discs, and then it will weave through the anterior or front portion of the pelvis and connect to the lesser trochanter on the femur. You're going to find the umbilicus or the belly button. You're going to palpate about 2 inches off to the side and press down very deeply, because this lies on the front side of the spine, in a anterior to posterior, front to back, and medial angle. And you're looking for tenderness. You're also looking for tension in the muscle, because when the patient's in the ideal position to palpate for this, supine or hook lying, it should be relaxed and it should not be tender. If you do find tenderness or tension at rest with any of these muscles that we're going to be talking about today, that does imply that there's something that's not quite normal. The iliacus, which works along with the psoas muscle, but primarily more as a leg mover, use your hand flat, palm of your hand, try to find the ASIS on the front part of the pelvis. So you're going to compress in, and I can find that little bony prominence right here. And what I'm going to do is go about 2 inches into that, and I'm going to hook my fingers, and I'm going to hook my fingers to get behind that bone and press out laterally into this muscle that lives on the inside of the outer pelvic bone. Now, those two muscles cause a lot of different problems. The iliacus muscle, because of how it connects to the innominate of the pelvis and also to the lesser trochanter, will cause potentially a innominate rotation, or the pelvis to rotate on a fixed sacrum. Now, if you don't mind turning around, facing the other direction. So when we're talking about the sacrum, which is right here in this area, and I'm going to just tuck your shirt into your bra here. I'll pull this down just a little bit. So the sacrum looks like an upside down triangle and sits right about here, right below L5. And if you're trying to figure out about where to start for palpating this, you can put your hands on the outside of the iliac crest on the top. And when you're palpating here, you will be at the level of L4, L5. If you keep your thumbs facing towards the center, you just go down about 2 inches, and you should feel somewhere in here the sacral base. Sacral base will basically be the top part of this bone here. Now, in this area, we can try to just lightly move the skin around and see what we feel. If this area is tight, where the skin doesn't move very well, her connective tissue here could be very tight. The erector spinae connect into this area. The latissimus dorsi connects into this area. And interestingly enough, if the sacral fascia here is bound down and not moving well, or if she's got adhesions, many times, for whatever reason, the multifidi along the sides of her spine will actually feel atrophied. So, talking about atrophy of this area, we're going to find the spinous process, and we're going to look for if she's feeling any, or if we can find any atrophy of her lumbar multifidi. This is best done in prone. So, the spinous process are these backward projecting bumps on the spine, and they're pretty easy to find no matter what position the patient's in. But if we're looking for the multifidi, we need them to be relaxed. So in prone works best. So you're going to just basically put your fingers in the center of the spine and wiggle your fingers up and down, back and forth, and try to find that bony little bump that jumps straight backwards. Now, remember, if they have a fracture of their spine, generally those will be very tender. Sometimes if you have a rotated segment, the ligament that connects the adjacent spinous processes can be a little bit tender as well. But once you find the spinous process, your fingers will, as you pull off to the side, dive down into this little gutter. And this is where the multifidi live, those deep little muscles in the back of the spine that stabilize the spine to make sure one segment doesn't move too much relative to the one above or below. And compare one side of the spine to the other. Your finger should maybe be about 1 centimeter at the most off of that spinous process when you're checking for this. Now, compare side to side, but also realize you should not be able to feel like your fingertips are pressing into the bone when you do this. The facets are going to be deep to the multifidi. And the facets are going to be, as you can see on this model here, basically right here where my fingertip is. And this is an oblique angle or a diagonal angle of the spine. So once you go down, you're going to come out a little bit more, probably about 1/2 centimeter, and hopefully then you will be over the facets. Now generally these won't be very tender, and with your fingers down deep in here, you're probably going to be putting pressure on a lot of different things. But for her, if I was palpating on her facets or palpating for her facets, my finger would be right here, and if I was palpating for the multifidi, my finger would be right here, and on just a slightly different angle, so there's not much of a difference. Her hip external rotators connect from the outer portion of the sacrum to the greater trochanter. If I put my hand flat on the side of her hips, the bony bump that juts out is her greater trochanter, and these muscles basically connect back to the sacrum. Now, what we're looking for here is not necessarily tenderness, we're not necessarily looking for tension, but in prone, we're looking for, in this area, atrophy. So with our hands on a 45-degree angle, with our fingertips facing forward and towards the middle, again, with her in prone, you're basically pressing deep. If your fingers, when you press deep, can hit the hard kind of back edge of the neck of the femur, there's some atrophy on one side or possibly on both if you can feel it on both sides. But you should feel when you're pressing in, if this area is healthy, you should feel a lot of muscle bulk and it should feel fairly symmetrical from side to side. The Psis, which if you're having a hard time finding the SI joint or this lateral sacral margin, if you put your hand flat on the backside of the pelvis, again, there should be a little bony bump that jumps out, and on her, it would be right here. Depending upon how thin the person is that you're working with, sometimes you can see a little dimple. That dimple can help you find that bony protuberance a little bit easier many times. The transverse processes of the lumbar spine, the easiest way I always find to start with this is, again, putting our hands on the top of the iliac crest at L4, L5, and have your fingers slide a little lateral, your thumb slide a little bit lateral. And with a patient, when you're checking this out in prone, when you press in with your thumbs, you should be able to assess and find that little bony bump that sticks out to the side. And you slowly kind of roll your fingers from segment to segment up the spine as you're assessing for tenderness, possibly depth of these different segments. Now, the Quadratus Lumborum connects from the bottom 2 ribs to every single lumbar vertebrae and the top of the pelvis. It many times goes into a spasm if the lumbar erector spinae or multifidi are atrophied, weak, or fatigued. And to find this, I generally would recommend in supine, you're going to press in and you will find or feel this vertical running muscle that's usually fairly thick and strappy, and probably about 1 inch above the iliac crest. That is where you'll find a tender spot in this muscle more often than not if it is pathologic in any way, shape, or form. The sciatic nerve, which comes off of the lower lumbar spine and sacral nerve roots, runs straight down the middle of the gluteals, straight down the middle of the back of the thigh to the back of the knee. And with that said, sometimes it's ticklish, but mainly you want to make sure that it's not tender. If this nerve is compressed in too many areas, whether it be in the spine or outside of the spine, if you press in with your thumb or finger with 5 to 10 pounds of force, it will be tender. If you're looking on someone for this and they're in supine, on their back with their legs extended, and you find that their hamstrings are too tense because they should be relaxed in supine, their calf is very tense in supine, and the foot intrinsic flexors are too tense, many times they'll actually have a problem with their sciatic nerve that is compressed somewhere, and that can be a good indication. The lateral calf, the gastrocnemius over here, is a great indicator if they have any problems with L5-S1. If the calf in general is relaxed when you palpate on it, but when you poke on the outer edge of it, you feel that it's tense, possibly tender, many times that is a big indicator that their L5-S1 nerve on that side is compressed in some way, shape, or form. And if you could face 90 degrees right. The greater trochanter, if you put your hand flat on the side of the hip, the bony bump that jumps out is where the gluteus medius connects to, gluteus medius on the side of the hip here. And if I put my hand again on the top of the hip, my other finger on the greater trochanter, the muscle lives right here with the gluteus medius being deep to it. This muscle should be non-tender when you palpate it when the patient's lying down. I generally check this out either in prone, supine, or hook line. But I just basically press in when the patient's in that position and relaxed. If you angle your fingers deep to it, theoretically, you might be pressing on the gluteus minimus, deep to the gluteus medius. But if those muscles have any sort of dysfunction, it does cause some sort of abnormal movement of the innominate on the sacrum, which can cause some SI joint problems. Possibly, if that joint's not moving well, some problems at L5-S1 from how the lumbar spine rests on the sacrum. The IT band on the outside of the thigh can also lead to some issues, or at least be an indicator if they have some issues of their hip external rotators and of their gluteus medius muscle over here. Generally, if the IT band feels like you have a sheet that is pulled tight just underneath the skin, that's the IT band. If you just feel like their whole outer thigh is tense, usually that implies that they've got a problem more with their Vastus Lateralis muscle. And if you could face front, thank you. So in the front, we've already talked about the psoas, we've talked about the iliacus muscles. The other relevant structure in this area is going to be the femoral triangle. We've got the femoral nerve that comes through there. You also have the tendons of the iliacus and the psoas muscle. And generally, when I look at this, I find the ASIS, the bony bump right here. I'm going to go medial and inferior to it. Right around in this area where the hip crease is where we're going to be looking for any sort of tension when you lightly palpate. Always get your patient's permission for this. And you're looking for, does that tissue move well in this area? If it feels like the tissue is very tight, it's not moving well, they might have some compression on their femoral nerve, they might also have some tightness in their hip flexors.